Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery Wisdom Teeth and Implant Center.
I'm Galen.
All right, so Kaylin's my dental assistant. She's been working with me for a year, and so I wanted to get her in this video to give you guys another perspective for someone who sees a lot of the patients. And with us being a dental implant center, we do regular dentures also. Not everybody is getting an all-on four or a snap-on denture, but not to give you a lecture on dentures or anything like that. We just really wanted to go over some of the pros and cons as to why a patient might want to do basically
Traditional denture.
yeah, traditional denture, right? So it's not the greatest thing in the world. Like, as we know that if you have finances are an issue, all-on four is going to be your best bet. But not everybody has the finances to be able to make a big investment like an all-on four. So that's where basically a regular denture comes into place. So let's talk about, what is a denture? A denture is a prosthetic. It's a prosthesis that, imitates your gums and your teeth. And it's made of plastic, and it can look great, right? At least it looks like you have teeth inside your mouth. But Kaylin, from your perspective, what are some of the drawbacks of a regular denture from a lot of the patients that have complaints, and that's why they might want to upgrade? Or what are some complaints that patients have?
So they'll get, if they already have dentures, they'll say it's low quality, so it affects the aesthetics of it. Low quality affects the functionality, the durability, eating. With it being on the roof of your mouth, feel like taste when they're eating food. Speech impediment, they have an overproduction of saliva, so they spit when they talk. Sometimes if it moves and it shifts, it can cause sores and it make it feel loose. They feel like sometimes the paste is too sticky, they can't get it off. There's a lot of things that patients feel like they say.
Right. So, man, we could talk like 20 minutes about this. Like a laundry list of complaints, right? So, kind of first starting off like at the beginning, your bone changes over time, right? So that's probably something you didn't even know before you started working here, right? But your bone atrophies. This denture is sitting on your jawbone and your gums. When you lost your teeth and you're not putting those forces down, your bone starts changing shape over time. That's why people's faces change over time. So dental implants are great to help maintain that, and unfortunately dentures don't have that ability to maintain the bone. And so when your bone is shrinking and this is staying the same size, what can happen is that you can get some rocking or movement over time, over the years, and that's what causes a lot of those sore spots. And like that can be really painful for some of the patients. Not only just sore spots, but if the denture's not fitting properly, then it's difficult to eat properly also. So again, like, this is where some of the drawbacks come from a regular denture. Now, let's not just be all about trashing this product or anything, but because again, like, dentures, I mean, we've read in history books that George Washington used to wear dentures, wooden dentures back in the day. So I'm sure this is a heck of a lot better than George Washington's denture. But realistically, you can smile, right? And
You can eat if you couldn't eat before.
yeah, you can eat, albeit not very well,
Yeah.
but you can still at least kind of like mash away at your food. But I mean, so those are like, some obviously big advantages. Drawbacks are that, again, over time, you can lose bone, your denture can start rocking and moving. A solution that people have for that is obviously the denture paste, right? So people have, like, whether the strips or the glue paste that they put on this to help get it to stay in place. And I've seen from a lot of patients that when they put a lot of that gummy, gooey stuff on here, it actually stays in pretty decent, right? So this is an upper denture. But a lower denture, you can put all the paste you want on it. It's a nightmare. And the reason that is the tongue. So every time you're talking or eating, your tongue moves, and therefore the floor of the mouth becomes elevated, and like your denture wants to dance around all the time, and basically eating becomes very difficult, right? So that's a huge frustration also. So I mean, I tell patients, consultations, we see the frustration when patients have bad teeth or have a regular denture. There's a reason why they're making a big investment in an all-on four or a snap-on denture. It's because they've just had so much frustration over the years with their regular denture or their bad teeth. So, the bottom line, patients might ask me, like, well, what's the bottom line? Like, what are you saying you recommend it's like a regular denture, or you don't recommend a regular denture? It's a solution. It's not horrendous, but it's not the best. It'll help you get by. At least it'll make it, you'll have teeth so you can, smile and you can communicate.
And it's affordable.
It's affordable. That's the biggest advantage. It's affordable. But again, the biggest drawbacks are, we lightly touched upon this. it's harder to taste foods, right? Because you have all this plastic in your mouth covering your salivary, I mean your taste buds. Um, it's kind of bulky. Some people get a gag reflex off of it. Not everybody. Some people. Enunciation, speaking becomes a little different. Eating becomes a lot more challenging. So those are some of those drawbacks. Was I missing anything else?
No.
Okay, so hopefully this information was helpful to help you decide. Obviously, cost, quality of life are going to be the two biggest things as to how you're going to decide whether you want an all-on-4 or a teeth-in-a-day solution, something that's fixed permanently, or whether you get a snap-on denture or you get a regular traditional plastic complete denture. So hopefully that answered a lot of your questions. If you guys have any other questions, please feel free to contact us or leave any comments below. Thanks.